Hello, I'm Dr. Venkat-Raman. I am a consultant nephrologist or kidney specialist, and I have been in medical practice for over 45 years, so I have a lot of experience. So I get referred patients with chronic kidney disease, and that is very widespread at the moment. And that is not to say that it is by and large difficult to treat. So what are the causes of chronic kidney disease? Today, the most common cause is actually diabetes, and then high blood pressure, inadequate blood flow to the kidneys, and less commonly, there are other causes like inflammation in the kidneys. So we won't go into any great detail about that. One of the commonest questions I'm asked is, what are the symptoms of chronic kidney disease? I'll call that CKD from here on. The symptoms are actually non-existent in the early stages, and therein lies the problem. The disease is identified totally by the blood test, where measurement is made of serum creatinine, and from that there is a derived value called the GFR. So the creatinine and the GFR define whether one has or has not CKD. So the symptoms, meaning what you will notice, would really be nothing, non-existent. Now, CKD has been graded or staged into 5 stages. Pointless going into the details of all of that, except to say that it's the stage 1, 2, and 3, the early ones, where you have no symptoms. Stage 4 and stage 5, which are the advanced stages, that's when symptoms start developing, and we expect to diagnose and treat long before that. Now, what about the actual treatment for CKD? So fundamentally, we treat the underlying cause of the CKD. So if a patient is diabetic, then proper tight control of diabetes is the most important measure. If the patient has high blood pressure, then good control of high blood pressure is very important. If there are other diseases causing the CKD, then treatment of those conditions is important. So first and foremost, we have to make a diagnosis and treat appropriately. What is the outcome? Is it a case that once somebody develops CKD, it is going to deteriorate progressively? And the answer is no. The vast majority of people with CKD will live and die with CKD. When I say die with CKD, I mean they would die of another cause, very often just old age. So there is absolutely no reason to panic about the fact that you have just been identified with CKD. So my job as a consultant is to achieve a diagnosis, and in the majority of cases, I'm able to reassure the patient that they will not progress. For the small minority who do progress, then of course, we do have to undertake dialysis or even a kidney transplant at some stage, hopefully a long way away, because we can offer so many treatments on the way. So the diagnosis of chronic kidney disease is by no means an automatic sentence for dialysis. As I say, in the majority, that's not the case. So sometimes I'm asked, is there a cure for CKD? And the answer is yes, because if it's a condition, the CKD that is, which is not progressive, then a cure is slightly academic. It's only really for the more progressive ones where we are concerned about a cure. And there, the current modern medications can provide probably a cure for about 25 to 50% of cases. So there is a lot that can be done. Now, in the current pandemic times, the question is asked about whether or not CKD could be an adverse risk factor for outcomes after COVID infection. And the answer sadly is yes. But that's usually, again, in the later stages, stage 4 and 5 of CKD, where it's a problem. In the earlier stages, you're at no greater risk for adverse outcomes. Needless to say, not getting COVID is the answer, so all the essential precautions should be undertaken. So in terms of consultations, I do face-to-face consultations in Portsmouth and Guildford, but I have a much more flexible system of teleconsultation by telephone or video, which can be flexibly arranged at a time to suit you. So I hope I have given you some quick and simple insights into chronic kidney disease, and I hope you have found this useful. Thank you for watching, and please don't hesitate to get in touch if you require any further help. Goodbye.